Welcome back. I'm Simi Sara. There are about 300 new cases of something called PKU every year, and dealing with this disease is nothing but a lifetime of challenge, especially since most of us don't even know what PKU actually is. Well, to explain it to us and to explain just how much of a challenge it really is, Nicole Pallone is with us. She's the mother of a 3-year-old with PKU. Thanks for being with us, Nicole.
Hi there.
I'm going to, first off, let's start with the basics here. What is this?
PKU is a rare genetic metabolic disorder which limits a person's ability to process an amino acid of protein called phenylalanine. I'll call it Phe from now on.
Okay, and so this is something that you said is rare, but not as rare as you might think. 1 in 12,000 newborns in North America actually gets this or has this.
That's right. Right now in BC, there's about 175 patients that are followed by a medical team in Vancouver.
And so what does it mean when you're dealing with this? How does it affect you?
Well, Phe, because it's not processed properly, Phe will build up in the bloodstream and it becomes toxic to the brain. So without diagnosis, without treatment, someone with PKU ends up severely mentally retarded. With proper treatment, most of the negative side effects are largely avoided.
Oh, is that your baby?
Well, that's the youngest one, yes. This one does not have PKU.
And so you have a daughter with PKU.
I have a daughter with PKU.
And how did you find out about that?
PKU is one of the things they screen for with the newborn heel prick test.
Okay.
So the government does think it's important enough to screen for it and diagnose for it. Unfortunately, they don't cover all the treatments that are available for it.
In what way? So are there drug treatments, or how does this work?
There are. The first and foremost treatment is a low phenylalanine diet. So there is a special amino acid formula which basically gives someone with PKU all the nutrients they need, including lots of protein, but just minus that phenylalanine so that their body isn't getting overloaded with Phe. That's really essential because their diet is so restricted that without the formula they would be lacking several nutrients.
And how expensive is that?
The formula, thankfully, is covered in BC for everyone with PKU, child and adult. What's not covered is the low Phe foods that are necessary and a new drug out that works very, very well for some called Kuvan.
Right, but I can't imagine, like, you talk about kids being picky eaters. At your house, though, the difference between eating something and not something, it's almost life or death.
It's very, very serious, and it's very, very stressful. Rosie can't have fish. She can't have meat. She can't have eggs, dairy, lentil, nuts, soy. She also is restricted in the amount of carbs she can have, and she can't have regular rice, regular pasta, regular bread.
So what can Rosie eat?
Rosie eats lots of fruits and lots of vegetables. We're very lucky, actually. She's not actually a picky eater because anything she is allowed to have, she eats. But she's limited to fruits and vegetables and the special low-Phe foods.
Wow. That's, you know what, I can't even imagine how much trouble that must be. But Nicole, we're going to take a quick break and we talk more with you when we come back to find out more about PKU. Stay with us.
Thanks.
Welcome back. I'm Simi Sara. We are talking with Nicole Pallone, who is a mother of a 3.5-year-old girl named Rosie. And that sounds simple, but what she has to do every day for Rosie is not very simple at all. Nicole, thanks very much for staying with us.
My pleasure.
What was your reaction when you first heard about the fact that Rosie had PKU?
Well, we were devastated, of course. We found out she had PKU on day 4 of her life. So I was a recent new-time mom, had just been discharged from hospital, and I thought my baby girl was perfect, which I know now she is anyway. But it's devastating, and it's rare. So we'd never heard of it. We didn't know what it was. The first thing we did was go online and do some research, and you read about mental retardation, and your perspective is grossly changed.
So will Rosie be able to manage this for a long life?
It is a lifelong disorder. There is currently no cure. You don't grow out of it. Right now, because she's so little, We have to weigh all her food and calculate how much protein she eats in a day and give her a specific amount. Birthday parties are hard. Lunches at school are hard. Eating out is hard. Making two completely separate meals already at the same time every night is really, really hard. And it's expensive. The low-fee foods that she needs are expensive.
Well, Nicole, you wanted to talk about this today. You wanted to bring awareness to people. What do you want them to know?
Oh, there's a lot, actually. I'll try and keep it short. The medical foods are necessary because, as you can imagine, you can't get enough calories from fruit and vegetables alone to meet your caloric intake for the day, especially as a kid. And that means if you don't meet your calorie intake, your body starts to feed off itself, and that's pure protein. So it sends her blood Phe levels through the roof, and that's when you get some neurocognitive damage. So they're really essential. They're 6 to 10 times the cost of regular food. The Kuvan is a new treatment that it's the only drug treatment for PKU. And it's not covered yet anywhere in Canada, but it is being reviewed right now in BC by the Drug Benefit Council. So it's it's a great time for us to bring awareness to it.
Well, how supportive sort of has the health ministry been towards this?
Any new drug is very expensive, so that is, I would expect, a large part of the holdup. Right now, Rosie is on it because she's in a drug trial. We're very convinced that it's safe, and for her it's very effective. It doubles the amount of natural protein she's allowed to have, which is going to be great for her in the long run. But if we had to pay for it out of pocket right now, it would be $40,000 a year.
Wow. That is expensive.
It is, and it goes up. It's by weight. So for an adult, it would be more. However, with PKU being so rare, and Kuvan doesn't work for all patients, it's only going to react in about half of the patients. So all said and done with the food and the Kuvan, we're not looking at a huge portion of the BC Health Ministry budget.
Right, so you would just like a little more assistance.
Yeah, we want some more assistance for sure. And I think part of the struggle for me is that having levels that aren't well controlled has a huge impact on quality of life, a huge impact on successful outcomes, and a huge impact on the provincial economics even, because somebody with not well-controlled levels, they're not working. They're not being a productive member of society. That means they're not paying taxes. They're utilizing more healthcare resources. It just snowballs.
But it must be really scary for you, though, Nicole, knowing that if Rosie just eats one wrong thing, just one thing, and it could happen anywhere, especially as she gets older, that it could have such an impact on her health.
It can, and it's unfortunate, too, that there's no immediate response. It's not like an allergic reaction. So if she was going to daycare, someone could be feeding her chicken every day, and I wouldn't really know until we got our blood results back, which, we do a blood test every 2 weeks, and then it takes about 10 days to get each one back. So
wow.
by the time you have some kind of indication that there is a problem, there's already been some neurocognitive damage.
Well, Nicole, if people would like more information, where should they go?
Our website is a good resource, canpku.org. The event on Sunday is open to everyone if anyone's interested.
It's a walkathon, right?
Yep, the walkathon, and there's an education series as well, so people can come down and learn more or make a donation, or I'm happy to answer any questions people have. All
right. Well, thanks very much. The website, again, is canpku.org. Nicole, thanks very much for being with us.
You're very welcome.
That is Nicole Pallone. If you'd like to help out, you can check out their website.